So I will share a little bit about Dr. Cecere, who is making up the bulk of today's presentation, and then pass things over to her for her presentation. So Dr. Cecere completed her veterinary education at the Virginia Maryland College of Veterinary Medicine. She worked in private veterinary practice and commercial settings before returning for residency in animal reproduction. Dr. Cecere is a diplomat of the American College of Theriogenology, an organization to which she has contributed in several leadership and service roles. She is clinical associate professor of theriogenology at the Virginia Maryland College of Veterinary Medicine, where she has developed an internationally recognized clinical service for canine reproduction. Dr. Cecere lives in Virginia with her family on a small hobby farm and enjoys upland dog hunting with her children and riding horses in her spare time. So Dr. Cecere, with that, I will pass things over to you to get our presentation started.
Thanks, Nicole. I really appreciate it. And if the puppy comes back on, everybody wants to see the puppy. Okay. So I'm going to apologize in advance a little bit for this, guys, because when I was asked to do this talk, there's a lot about pharmaceuticals that we do know, and there's a lot that we don't know. And so my goal for this talk today was to kind of give you guys a little bit of a background on what your veterinarian and you guys should be thinking about with your hopefully healthy animal and or in the future going to be reproducing or currently reproducing, the conversations and the thought process that goes through if we have to use a pharmaceutical. Is it safe? Is it not safe? What are the pros and cons? And do we absolutely need that product? Because there's a lot of things that can do harm without us even really thinking about it. And so again, it kind of comes back to this tongue-in-cheek kind of, if a little is good, then more must be better. That's not always the situation, especially when it comes to pharmaceuticals. If we're sitting here talking about puppies, obviously more is better. This is my best life, is when I get to have a litter of puppies come in and they get to swarm all over me. But that being said, we're gonna get a little bit into the pharmacology and the nitty-gritty, and then I'm going to try to give you guys some examples, and we're going to walk through some stuff, but we're going to be kind of bouncing back and forth through some things, and hopefully get you guys a better understanding of the thought process that needs to happen when something comes up and you have to use a pharmaceutical. And so the biggest thing that we're going to talk about, and I'm going to spend some time on the first couple of slides, is going to be talking about how animals metabolize, and or the pharmacokinetics that are behind. So pharmacokinetics is the study of once the animal or the drug enters the animal's body, how is that animal going to metabolize it, and how long does it take to leave the body or leave its effective range, and then do we have to worry about residues and those types of things. Then specifically, I'm going to go through some major categories. So parasite control is something that we are all likely doing monthly. And so there are lots of products out on the market. We're going to talk about some of the products that are safe and some that we are questioning whether they are safe. Antibiotics, again, there are a lot of reasons why we might need to use antibiotics, but there are certainly some that are safe and some that are not safe. And so that's going to be really, really important. And then I'm generalized pharmaceuticals. A lot of these things can kind of get lumped in with the antibiotics as well. The thought process is still the same. And hopefully we could spend hours going through exhaustive lists on what we could and couldn't use. And if it's going to be helpful or not. And then we're going to do a couple of slides on supplements, because certainly there's a big difference between FDA approved products that are approved in use of some animal and we're using them off label versus supplements that are not regulated at all. And so that's going to be really, really different. And my dad loves to make this joke. He said, if you take 365 tablets of Tylenol on January 1st of each year, you're not going to have a headache all year long. And obviously that seems ludicrous, and it is ludicrous. But at the same time, it kind of goes back to the title of my talk. It's, if some is good, more is not always better. Nicole, Andrew, do you guys want to show a picture of the puppy really quick? Do you want to jump on, or do you want me to just keep powering through? Okay, I'll keep going. All right. So again, just bear with me, because there are going to be some things that come up that you're going to be like, whoa. So one of the big things when you as an owner are sitting in your clinic with your veterinarian and there's something going on and you're discussing whether or not it's okay to use a pharmaceutical. Drug safety is really, really important. And so if you look at this exhaustive list of things that we need to think about, specifically if your animal is either currently pregnant or has been recently bred, and or you're a male dog that has breedings that are coming up, this is really, really important. And so the species of the animal is huge. Just because it works really, really well in humans doesn't necessarily mean it works really, really well in dogs. A prime example of this is going to be tramadol. Tramadol in humans is actually metabolized to a very potent opioid in the body of humans. But when you give it to dogs, for example, it is not converted as easily in dogs as it is in humans. So again, the species of the animal is going to depend on drug size. This comes into play big time when we're talking about things that are going to cross into the placenta. And so if we're worried about getting to a potential infection that is happening in the uterus and or in the puppies, then we need to talk about the size of the drug, the molecule that's there, and whether or not it can cross. The lipid solubility and its pH is also going to play a role. A big example of this is if your dog has prostate issues. There's a difference in the pH of the blood and the pH of the prostate. Same thing with the brain. There's a difference between the blood and the brain. You need to have a pH that's going to be able to go across that barrier to be able to get where it needs to go. And so that's really, really important. Drug dose, okay? So are we going to be dosing this on a fairly regular interval? Do we have a long-term release? Do we have something that needs to be at a much higher dose so it stays at an effective level for longer? And those all play into the decisions that we make. Duration of the drug exposure. And this kind of goes into when we're talking about residues. Does it take a while for that drug to leave the body? And should we be concerned about it still being there? The placental blood supply. This is something we talk about when we're talking about C-sections. We need to make sure that we're not giving a pharmaceutical that's going to diminish the placental blood supply, because then we're diminishing what's being delivered to those babies as far as nutrients and oxygen. So again, those types of things are really important. Age of gestation. A lot of these drugs, why they may be safe later in pregnancy, are typically not always going to be safe early on in pregnancy because they're going to be embryotoxic or teratogens. And so once we're past the embryologic stage as far as formation of our major parts of our body, it may be safe to use those drugs, whereas if she had just been bred, it's probably something we should avoid unless we absolutely have to. Placental drug metabolizing capability. So this is something that's studied a lot in humans, where we talk about the placenta actually having the ability to metabolize drugs and break them down. And so, for example, in humans, women that have hypothyroidism and they're taking levothyroxine, they have drug dosages that have to be adjusted during pregnancy because the placenta actually can metabolize levothyroxine and will bind it so that they actually have to have trimester specific drug dosages. And so again, these are types of things that we think about. We don't have as much research about them, but it's coming out every day. And then again, talking about maternal fetal pH differentials and drug protein binding differences is going to be really, really important. So over here, I kind of just stole this from the internet. This was actually a paper that they were looking at the pharmacokinetics of a long-acting doxycycline. Over here is like the concentration of the drugs in micrograms per mil, and this is the timeout from when it was given. So 0 hours is when the drug was actually given to them, and you can see that we have very different products that are here. But you can see kind of over time how the concentration of drug is going to go down. But about the same time, all of them have an onset of action about an hour by the time they actually get to where we need to be. But if you're looking at this DOX3, we actually have kind of a pulsatile up and down. And so again, this is going to be individualistic, and this is also going to be something that is going to be affected potentially by, did I have a meal? Did I not have a meal? What time of the day did I get it? And so again, it's not just straightforward. One of the other things that we have to talk about is residue and half-life. And so residue is defined as any compound or chemical that's found in an organism's tissue or a part of its tissue. So for example, we talk about this a lot in withdrawal times for food animals. There are very specific drugs that we cannot use in food animals because we don't want that drug to be found in an animal that actually hits the shelf where somebody's going to be eating it. There are banned substances that we can use, and there are substances that have a withdrawal time, and that's so that we can actually make sure that the drug is metabolized and that it actually leaves the system before it hits our food chain. That being said, we don't typically eat our dogs in this country, but it still makes a big difference because we need to know how long that drug is going to hang around. And that leads us to our second definition here, which is half-life. It's the time that it takes for the concentration of that drug to be reduced by half. This is obviously going to be very affected by what the initial dosing that you were doing. A smaller dose is going to have less time, or it's going to take less time for it to clear the body versus a much larger dose is going to take a little bit longer. And so I have two specific drugs here just to kind of hit this one home a little bit. So the first drug here, Fluinair, you guys are going to know it more as Bravecto. Its actual half-life is reported to 9 to 16 days. All right, that's great. But effective time to elimination after a single dose, this is a 3-month product, is going to be 6 months. You give one 3-month Bravecto feed through, and it takes 6 months to fully clear the body. Let that sink in a little bit. The other one that I have here is fentanyl. It's something that we use for sedation and for short-term pain control. One IV dose, it is effective and hangs around for about 2.5 minutes. All right, that's at its half-life. That's its actual pharmacokinetic half-life, but time to full elimination is 30 to 45 minutes. And so again, we have a long-acting residue potential in the first drug. And then the second drug, even with repeated dosing, it may last a little bit longer, but it's still only 30 to 45 minutes. So residue and half-life are going to make a big difference and something that need to be considered whenever we're talking about putting anything in our animal's body, especially if they're planning on being bred, have been bred, are pregnant, and or breeding is coming up, because not all drugs are created equal. So that leads us to these drug categories. And I don't know if many of you guys have ever seen these before. They are definitely well known in the human OBGYN realm. We certainly have them, and they're pulled over from the OBGYN human side of things to use in animals. And we have category A, B, C, and D. And this is kind of like, from okay to don't use at all. And it's based on whether we actually have studies in dogs and or cats. We have studies in rodents and or humans, and we don't have any studies or we know that there are problems. So any category A is probably safe. Either we do have specific studies or we know that it's okay in laboratory animals and women. And majority of things that we will hopefully use in a theory practice are going to be in that category A. Amoxicillin would fall into that category. Safe for use, B is safe for use if used cautiously. Again, laboratory animals may have uncovered risk, but they appear safe in dogs and cats if they're administered in that late gestation time frame. And so again, A's and B's are going to be the ones that we're typically going to use. C's are going to be potential risks. So we know in people or laboratory animals that we have risks. We only choose to use category C's if we absolutely have to. And that's only when the benefit is going to outweigh the risk. And those are things, for example, that if we have animals that are having a very severe infection or something that is happening, and it's either save the vessel or save the cargo, hopefully most animals are going to say, we want to save the vessel. So we're going to have to give mom this drug, and we'll have to deal with the consequences if we have to later on with the babies. And then D, absolutely contraindicated. We know that this is causing malformations or embryo toxicity. So we try not to use those at all. But again, sometimes we may have to reach for the Ds. It depends on the product. It depends on the condition. And it is a very open conversation. And one of the good things about the internet these days is that you can very easily look up the drug studies that they have done. Make sure you're not looking on Facebook. You're not just Googling this and relying on ChatGPT or the AI. Go find the actual papers of the product insert and read and know what they want to do. What they want to give, and then you guys can have a very educated conversation. So we're going to kind of flow into antiparasitics. And oh my gosh, you walk into our pharmacy here and it is just, there are so many antiparasitics out there. And what I'm going to try to do is we're going to try to, in chart format, kind of digest this down to what's safe and what's not safe is there a study? Is there not a study? And then I'm going to actually show you kind of some of the white papers, that is the product insert or the actual study that was done to kind of say why we don't recommend certain things over other things. And try to digest this a little bit for you guys, because this is something that we talk about in practice all day, every day. And something that can be very confusing to owners, especially if a product actually carries a label of safe, but then when you actually read the product insert, it's not safe based on the studies that were done. So what do we know that's safe as far as parasitics go? Ivermectin has been around for many years. It will do hooks, rounds, and heartworms. There is a study. We know it's safe. Ivermectin is something that we're okay with. Pyrantel, same thing. Fenbendazole, same thing. Mealbumycin and selamectin also have studies, and we know that they're safe for these types of things. Fipronil, Frontline or Frontline Plus, fleas and ticks. Now, certainly in our area in Virginia and the Eastern Seaboard, Frontline doesn't work anymore, but in my area, Frontline is still working. And then the one that we're going to put on here that's a newer product is going to be the Seresto collars. And so again, we know that it gets the ticks and the fleas. And as far as we know, there's no studies that have been done. But this is what we recommend when we're having problems with Frontline or Frontline Plus. But that also hasn't been studied, but we know that it is safe to give pregnant animals these products, because the worst thing is when we have animals that come in that are bred or pregnant and they have heartworm because they weren't on heartworm preventative and or they weren't on a good flea and tick or mosquito repellent. So again, just making sure that you guys realize we're not pushing products here. We're just saying that what's safe and what's not safe. There are some things that are going to definitely outperform others in very specific regions. Now, what should be avoided? And these are things that we definitely have studies on, and we're going to walk through them a little bit. Fenbendazole and Drontal Plus. We know that the plus part of this fenbendazole, which is the active ingredient, is not safe, and I'll show you the white papers as to why. Amoxicillin and imidacloprid, which is the Advantage multi, is not safe just because of the drug class that it's in. Pyrethrins, pyrethroids, and permethrins. So Advantix, Vectra, Frontline, Tritech. There's a bunch of other products that are out there now that we have generic products. Just make sure you know what the active ingredient is. If you absolutely have to use the pyrethrins and the pyrethroid drug class, then you can, but as a frontline defense, we typically don't recommend them. And now this is the last three are going to be the absolutely do not use. So Comfortis, and again, I'll show you the white papers for that. There was a study done. The Trifexis, again, that's something that's spinosad and mealbumycin. We say absolutely not. Mealbumycin in itself is fine. The spinosad is the problem. And then we have this whole class of isoxazoline drugs. And those are your NexGards, your Bravectos, your Crudela, your Simparica. And you can tell because the last four letters in the name have ANER. And what's happening is that the study that is out there was on the 3-month Bravecto, and I'll show you the white paper on that. It carries, unfortunately, the Bravecto does carry safe for pregnancy. But once we show you the white paper, I want you guys to make your own decisions. We typically just try to avoid the feed-throughs, and we'll talk why we avoid those a little bit once I actually let you see what the white paper is saying about that. So here's the section out of the actual white paper for the Drontal Plus. Drontal, plain Drontal, which is just Pyrantel and Praziquantel, is perfectly fine. It's this last product that's the issue. If you read here, combination of Fenbendazole and Praziquantel in early pregnancy demonstrated an increased incidence of abortion and fetal abnormalities. And so again, why deworming your animal during pregnancy may be something that you have to do. Make sure you understand what's in the product that they want to give, and that we actually have a indication to do so, and you know what those drugs are and if they're safe or not. And I think my lines got messed up. They did. No. So on here, if we read through here for the spinosad, this is known as Comfortis, and it's still out there on the market. They were treating these dams at 1.3 times the maximum dose. So again, we're just a little over what the recommended dose. The puppies that were born to that had lower body weights. than control dams. And the mortality wasn't different, but the puppies from the treated dams had more lethargy, dehydration, weakness, and felt cold to the touch. So again, something that we're going to be pretty concerned about when you're saying, I need to treat my dam who may be pregnant. I don't want to affect the puppies at the same time because these are feed-through products. These aren't topical, right? All right. Then we talk about trifexa. So you take the drug that was before, which was the Comfortis, which is spinosad only, and then you add the mealbendamycin. The mealbendamycin is fine, but the spinosad is not. So in the one-time group that they gave, again, this is one time over the upper half of the therapeutic dose, we had cleft palate, anophthalmia, which means it didn't have eyes, fused single nares, misshapen palate, hydrocephalus, omphalocele, and malpositioned testes. And so again, that's pretty unusual. We also had a puppy that had a PDA. And then if they went to the 3 times, so this is 3 times over the therapeutic recommendation, we had malformations, PDA, and a malpositioned superior vena cava or inferior vena cava. So again, when we're reading what these products are doing, this is what's required by a drug to be approved for use. And if they're going to give it want to give it a label for safe in pregnancy, then they have to study it in pregnant dams, or they'll just say the efficacy hasn't been shown in pregnancy. And then we kind of go, maybe we shouldn't, maybe we should, depending on what the drug is and how it acts. So again, the trifexa, it's still out on the market, but again, just be careful of what you're doing. So now we're going to come to the last product. And so again, they wanted to get a label for safe during pregnancy. And so they administered it to early to intact, reproductively sound male and female beagles at 3 times the maximum label dose on 3 to 4 occasions at 8-week intervals. So they loaded them. So that's the first thing that I need to say. They didn't seem to have a problem on body weights, food consumptions, anything on the adult dogs and or the puppies that were resultant. But if you come down here, that we gave it to pregnant animals, and 7 pups from the 2 of the 10 dams had 4 of them had limb deformities, 2 of them had enlarged hearts, 3 of them had enlarged spleens, and 2 of them have cleft palates. And so again, that type of label makes me kind of give pause to say, granted, I know that we're giving this at a higher label dose, but at the same time, how is this considered safe for pregnancy? This makes me really worried. And remember, this study was done on the 3-month Bravecto. If we go back and think about what the actual half-life of the Bravecto is, it's 9 to 16 hours, okay? But it takes 6 months to clear the body completely so that we go down to 0 concentration whatsoever in the body. You've got to worry about, if this is given repeatedly over multiple months, how much residue do we have in the body, and is it going to have an effect? So again, just because it goes in and lasts for 3 months, it's going to be hanging around for a little bit longer, even if it's not at a therapeutic level. But to an embryo, and or to an oocyte or to a spermatocyte, it can actually have an effect on something that is rapidly dividing, okay? The other thing about this is you've got to be really careful. So again, I don't want people to think that I'm product bashing, but we need to be aware of, especially in our breeding population, is that now the FDA, as of 2023, this has come out for many, many years, but as of 2023, the FDA does put an alert out there saying that neurologic adverse events in the isoxazoline flea and tick products is a known problem. So if you have a breed that you know has idiopathic epilepsy or epileptic problems, likely should avoid the isoxazoline drug class. Again, why play with fire? So again, this is something that's really, really, really important, making sure that you're aware of what products are out there. Don't trust what the label actually says. Read the white paper and have a conversation with your veterinarian about it, because it can actually make a big difference. And there's a huge difference between a product that lasts for a month versus a product that's going to last for 3 months. The residues and the half-lives are going to be very different of those 2 products. So be aware of what you're giving, how long it lasts, and the potential side effects when you do it. Because those feed-throughs, once you give it, you can't get it back, okay? Okay, so when we're talking about antiparasitics, the bottom line is year-round heartworm preventative and flea and tick product for all animals would be ideal, okay? For brood bitches, Again, heartworm preventative and the flea and pick. If they're not on a monthly deworming product, then we need to make sure that she's dewormed along with her babies. If she's been on that monthly heartworm preventative and flea and tick, then you don't have to worry about that. If they're only giving ivermectin drench or nothing at all during pregnancy, which some people choose to do that, that's fine. We need to make sure that we're deworming during pregnancy, 41, 42, and 43 days of gestation with fenbendazole. Again, this is going to reduce our transmammary and transplacental migration of internal parasites. And or you can use selamectin, which is a topical, and your veterinarians should know how to do this. This is very well published data. As far as your puppies go, to try to avoid, you know, the wormy, unthrifty looking puppy, we should be giving Pyrantel starting at 2 weeks of age. The way I was taught it is 2, 4, 6, and 8 Pyrantel Pamoate. That's kind of the little jingle we sing in our heads. So they get it at 2, 4, and 6 weeks of age, and then at 8 weeks of age, they can start a heartworm preventative. But just making sure that the entire kennel is not going to be harboring these internal parasites, that we're making sure that we're deworming appropriately. And the nice thing about Pyrantel is that this stays in the GI tract. It's not actually systemically absorbed. And while, yes, I know that there can be toxic doses of things, but Pyrantel in itself is pretty inert. There's not much that we're going to do. It's only going to affect the parasites that are in the body. Okay, so hopefully we've covered that. That's a major class, is the antiparasitics. That's something that we talk about and that we worry about, and something that we know that there are safe products out there and there are unsafe products out there. We're going to move on a little bit more to the common pharmaceuticals. And so I have broad topic areas here to talk about. So antibiotics, I was very interested and did a lot of literature searching. And one of the top things that I was searching was, what are the top 10 things that we use in veterinary medicine that are prescribed antibiotic wise, NSAID wise, steroids, all those types of things, and then kind of delving into what the potential negative effects are. And so we're going to kind of talk about these a little bit. I'm going to give you kind of the top few that we're using in these classes. Antibiotics, your penicillins, your fluoroquinolones are going to be up there. For your NSAIDs, we're talking enrofloxacin, or excuse me, we're talking carprofen, meloxicam, thyrocoxibs. The steroids, we're going to be talking about prednisone, prednisolone, and dexamethasone. Sedatives and behavior modifiers, oh man, trazodone, we call it vitamin T, at least here at this clinic, because it does work very, very well. But we're going to talk about opioids, we're going to talk about dissociatives, all of these types of things that are out there. Hormone or a specific target. So these are going to be things that we might be using for cardiac conditions. We might be using for hypothyroidism. We might be using for other endocrine diseases. And those things that are going to be out there, again, it's going to be a case-by-case basis, but making sure that we know what those are. And then chemotherapeutics, and Christine's going to come up, and as well as others. And so again, just making sure that if it comes to a situation that we have got to use one of these, we're not just doing it just because that's why we're doing it. We're doing it because we're actually having a thought process of what we're giving, what the pros and cons are, and what the potential side effects are. And so I've kind of broken these down a little bit into female and male effects. So the female here, so we're looking at teratotoxicity, okay, so whether or not we're going to cause defects, embryotoxic, where we actually might lose the pregnancy. So midline defects and or limb abnormalities or other birth defects are certainly going to be something that we worry about. And so I know clinically, personally, I have seen animals that have been on that 3-month Bravecto product and or have been in the washout period for that product that have had kinked tails. And so that's something that if 100% of the litter is affected, then we know that was more like a toxin. That was not something that was genetic, and we would be concerned about that. Obviously, abortion, where we actually cause an abortion by giving a specific drug. One of the biggest ones here is a steroid. If we were to give them a high level of steroid, we know that we can cause abortions. So they need to be really, really careful with that. Teeth staining in the offspring, so doxycycline is a poster child for that. So again, being really, really careful. Cartilage damage in the offspring. This is something that comes with the fluoroquinolones, the antibiotics such as enrofloxacin, marvofloxacin, Baytril, that drug class. We got to be really, really careful in our neonates and in our pregnant dams to make sure that we're not loading. If we have to use the antibiotic, that's fine, but we need to make sure that the pros outweigh the cons and that we're fully aware of that. And then neonatal viability. And this kind of comes down to C-sections, making sure that if you're doing a emergent or urgent or planned C-section, that we are considering, and this comes back to our list, we're not going to reduce our circulation in our body. Okay. We want to make sure that that placenta has plenty of circulation so that we're still delivering oxygen to those neonates. We want to make sure we're trying to give things that are reversible, so that we can take it away if we have an adverse reaction or something happens. And we want things that are going to be fairly short acting. Okay. We don't want them to hang around for 12 hours because that means the puppies are going to be exposed to that and they're going to have it in their systems and may or may not be reversible. So again, those types of conversations always should be happening, and making sure that we're not just, oh, this is my anesthetic protocol for everything that we do for anesthesia. We really need to make sure that we're adjusting those doses and using those products judiciously to make sure that we're getting the desired effect, but we're not having a negative effect inadvertently when we're doing that. Now, on the male side, you got to remember the most rapidly dividing cells in a male's body are going to be their sperm cells, and he is 50% of the equation. And so we definitely need to be considering how it's affecting him as well. There are drugs out there that we know will decrease sperm output. Okay, specifically if we're suppressing his ability to have that gonadal axis on the things that happen. We can affect their motility. There are definitely drugs out there that will affect their motility. We know that we can cause increased morphologic defects by some of these drugs as well. And out of all of the papers that I read and all of the things I was looking at, there was a 2020 paper that came out that was looking at human sperm parameters, but they were also looking in the literature as far as rodents and compared to dogs. And out of all of the species that they looked at in this paper, dogs were the most sensitive to any spermatotoxicants. So if it didn't seem to have much of an effect in humans and had a minor effect in rats and or mice, for some reason, dogs were extremely sensitive. And so we need to be really careful about what's going on, what we're giving them, and whether or not they're going to have effect. And then you need to remember for the male side of things, if it's absolutely necessary, then we give them their course of antibiotics and or drug that they need, and then it's going to take them 60 to 70 days to probably rebound from that. And so if you have a breeding that's coming up and something happens, because that's what life does, then we need to be very open and share with them that we may have a drop in our sperm quality and whether or not that's going to affect our breeding coming up, and being very open with the female side of things that, hey, you may need to switch to a plan B male. I will repeat this breeding, in the future after he recovers. It may not come to fruition, or he may still be able to affect him the larder, but depending on how things happen, you just need to be aware that these things can negatively affect your males. So what does that mean? There's thousands upon thousands of drugs out in the world. So this is not an exhaustive, all-inclusive list, but generally, if we're going to put them into safe, not safe, penicillins are always going to be safe. Anything in that drug class. Cephalosporins are always going to be safe. And TMS is also going to be safe, unless you are a black and tan. So Dobermans and Rottweilers, we have to be really careful with TMS. Levothyroxine is very safe, but that also is going to lead us to the debate of do we specifically need to be breeding animals that are on levothyroxine or not? That's a conversation for another day. Opioids as a whole are safe. They're reversible. Okay. Again, we're going to err on the side of using something that's a little bit more short acting if we have to. NSAIDs as a whole are safe to use. Again, as little as possible to be effective is going to be helpful. Benadryl in pregnancy and in other times is extremely safe, and famotidine is extremely safe. So I've covered quite a bit of things there that we might use on a daily basis for specific things. But I think the other column, the right-hand column, is going to be a little bit more important. Metronidazole. Metronidazole should only be used when it's clearly indicated. It is not candy. It shouldn't be given to every animal who has diarrhea. It can cause neurologic effects. It can cause negative effects in sperm cells. And so again, that's a definite no. Gentamicin as an antibiotic is a no. Fluoroquinolones, again, ideally, these fluoroquinolones are not quite a reserve antibiotic, but they're very close to that. If we keep using them as often as we are in general practices, I would say in my lifetime as a veterinarian, we are going to have so much resistance that we're not going to have those drugs anymore. So again, judicious use of these and not throwing them at everything is going to reserve those for our future. Chemotherapeutics, again, if your animal's on a chemotherapeutic, we shouldn't be breeding them. But if there's something happens during a pregnancy or they are diagnosed with something and it's a male dog or what have you, then again, that's a different conversation, but something that you need to be aware of. Tetracyclines, we should stay away from as a whole. Steroid hormones, steer away from as a whole. The antifungals, ketoconazole, can certainly have a pretty negative effect on sperm parameters as well as in neonates. So we got to be really, really careful about that. And anticonvulsants and antidepressants. We know this in humans, we know this in mice, and we have some studies in dogs that we know that they're going to have a negative effect. So again, these are trying to give you a few drug classes that we know absolutely to avoid and or just kind of broad range. The bottom line is it's really just making sure that the situation fits what the treatment's going to be and then having a candid conversation about is that treatment known to cause a problem? Where does it fall in the ABCD category? And if it's not in that ABCD category, then do we absolutely need to use it, or is there something that's going to be more safe and just as effective? Okay. So lastly, what we're going to talk about, we're going to talk about diet/supplementation. And this is not something that I'm sure you guys have not heard before. It's not going to be new news, hopefully, but it may hopefully add a little bit to it. So pregnancy and or I prefer our kennels that have multiple dogs, everybody be on life stages. All life stage diets. It makes everything a lot easier. You're not switching back and forth between diets. Everybody's going to be getting what they need. DHA is imperative for puppy neural and retinal development, and that's something that they need to be getting from day one. And so usually we tell people switch their dogs over to an all life stages or puppy food 1 to 2 months before their heat cycle is expected. That way they're already on the food and it's on board. And again, it's to make sure that we maximize that neural and retinal development. We talk about folic acid supplementation for breeds that are predisposed to midline defects or have history of midline defects. The dosage of that is not something that you're ever going to get over the counter. And we actually have that dosage compounded so that we can make sure that that dam is receiving the correct dose to have an effect. And humans metabolize folic acid much different than dogs do, and hence why the dose is much, much higher. The bottom line is we have to be really careful about supplements because supplements are not controlled by the Food and Drug Administration like our pharmaceuticals are. They don't have to go through the same parameters. They don't have the overseeing and the overarching control and or saying that, okay, if I tell you that this has got 5 milligrams per tablet of whatever the active ingredient is, there's no overarching regulation on making sure that that's what is actually in that pill. And so we've got to be really careful about what we decide to use or not use. And one of the biggest examples of this is calcium supplementation. If a breeder is giving calcium supplementation during pregnancy or after whelping, they need to make sure that it doesn't have a vitamin D carrier associated with it, because calcium and vitamin D go together, and calcium in itself in high amounts, other than withdrawing it quickly, doesn't have a negative effect. But high vitamin D can actually damage your animal's kidneys. So making sure that you know exactly what is in that product and how much and what the toxic dose are is going to be really, really important. Same thing for like raspberry leaves. Raspberry leaves are something that can cause uterine irritability. That being said, you go out and you look at all of these supplements that are out there on the market for these females that are pregnant and or that they're going to be breeding. Raspberry leaf is in the top 3 or 4 ingredients that are there. So again, whether or not that's something you want to be giving your dog is very important. General vitamins, the same type of thing. You may not want to be giving something that's going to unbalance your diet, and make sure that you, again, just because a little bit is good doesn't mean more is better. And what you're going to risk is actually unbalancing the diet that you have. And then the same thing with vitamin A. Excess amounts of vitamin A, hypervitaminosis A, can actually cause midline defects. And you don't want to find that out when you've whelped an entire litter that has cleft palates or other type of midline defects. And then you go back and find out that the product that you were feeding them had too much vitamin A in it, and that was the cause of the midline defects. So be really, really careful about that. On the male side, they also tout a bunch of supplements that you can give. The first and foremost thing, and I think Dr. Hesser would probably agree with this, is making sure that you're selecting for good fertility. Nutrition isn't going to make up for that, okay? You got to make sure that you're selecting for good fertility first and foremost, okay? But if you also look at the supplements that are out there on the market, we need to avoid specific things. So cottonseed meal, we know, actually causes some poor semen parameters. Phytoestrogens, things that contain a lot of legumes in them, also are going to cause some problems. And excess selenium is also going to cause some problems. So that alone, make sure you know what's in the product, what they're claiming is in the product, and if they contain these things, then you might want to say no thanks, because it's not going to help anything and has more potential to do damage. Excess heat to the scrotum or ambient temperature. So if you live in Texas or in the southern states, you need to be really, really careful. If you're a show dog and you have a coated breed, making sure that you're using forced air around the scrotum, because that's going to have a negative effect. The things that we know may help probably aren't going to hurt. Glucosamine is never going to hurt anything. Okay, so that's not going to hurt anything. And then the only specific study that we have out there that shows a difference in semen quality was the prescription diet for joint health that contained therapeutic levels of glucosamine. Or they had a diet supplement that they made on their own that had very specific ingredients in that. The bottom line is if you want to do something, you can put them on joint supplements or you can put them on a joint diet. That's probably going to improve their semen parameters, but be very careful trying to piecemeal this together with human products off of the shelves. And we certainly talk about these 3N PUFAs, PUFAs, polyunsaturated fatty acids, zinc, selenium, vitamin E, and vitamin 9, which is folic acid. The problem is in themselves at therapeutic prescribed dosages, they're fine. But if you're giving them in excessive amounts, you actually are going to decrease your sperm motility. So you need to be really, really careful about, again, piecemealing these things together and make sure you know what's in your product. And if it truly is in the product, avoiding things that we know are going to be negative. And then putting in a plug for the National Animal Supplement Council. This is if your product carries this seal, then they have had a independent validation that has approved what they claim in the amounts is on their actual product is actually in that product when it was independent validated. So really, really important. You guys can go to this website and you can find a list of the companies that are there. But the bottom line is with supplementation, if you're feeding them an appropriate diet that is well balanced, you should not need any extra supplementation unless you and your veterinarian and your ureagenologist talk about it and you guys decide what products are safe. And what does that come down to? This is for all pharmaceuticals. So we're going to kind of, lump this all together. All with careful consideration. If you're going to put something other than food in your animal's mouth, we need to consider the pros and the cons. Is there something that's safer and better? And what's the shortest amount of time that we can have the effect that we want without actually causing any negative effects? Risk benefit, if we're doing something that requires an antibiotic, do we have something that's called a culture and an MIC so that we know and we're sure that that product is going to be effective against whatever it is? Does it get to where we need to go? If we're just giving an antibiotic, let's say, for example, if we have an animal that's got a prostate issue, because of the pH difference between the prostate and the blood, we know there are specific pharmaceuticals that are going to penetrate that better and with more effectiveness than other antibiotics. And so there would be certain things that we would use and certain things that we wouldn't use. Do not jump to reserve antibiotics. Please, 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 please. We really, truly are seeing an increase in the amount of bugs that are in the world that have resistance to a lot of these antibiotics. And if we just keep throwing antibiotics at things that may not need them, or we're using them for 2 weeks when they only needed them for 5 days, we're not going to have them for very long. So we need to be really, really careful. And then bottom line for supplements, just don't do it. It's not really necessary. If they're on a all life stages diet or something that's been balanced by a veterinary nutritionist, then you should be providing everything that they need. Omega-3s or 6s are perfectly fine. DHA is perfectly fine, and joint supplements are perfectly fine. But again, if you're reaching for something else, make sure that you know what's in it. Make sure that it is actually in the amounts that they claim is actually what's there, and that it's got that seal. And making sure that we know what's going in our animals' mouths, and that we are doing the best decision making that we can to make it safe. So again, any pharmaceutical, be very careful. Read your product inserts. And again, I'm not a huge smartphone lover. I really, I loathe being connected all the time, but at the same time, in this instance, looking up these papers and looking at what's on the product label is going to be really, really helpful. And discuss those products with your vet and theriogenologist. I would tell you probably 50 or 60% of the vets out there have no idea that Bravecto is actually labeled safe for pregnancy, but they've never actually read the product insert and have no idea about those birth defects that those puppies had in that study. And then nutrition is a breeder and owner hot topic, as well as supplementation. Educate yourself and educate yourself some more and educate yourself some more, and make sure these are peer-reviewed sites, that you're not getting this is off the breeder forums, because again, everybody's going to have an association, whether or not that was a true effect versus just an association. It's going to be really, really big. And remember, those supplements may do more harm than good. So if it's not going to hurt them, fine, but be careful of what you're giving. And then a plug for raw is not a good idea for many reasons. But in breeding bitches, during breeding, pregnancy, and lactation, please avoid it. We've had plenty of animals that have gotten sick during pregnancy and or have lost puppies postpartum due to foodborne illness and raw foods. So be really, really careful about that. With that, here are some references, and then I'd be happy to take any questions.
Great. Thank you so much. We do have one general question to start on the presentation. For the drug class list, was that the safe and unsafe, was that applicable to both males and females?
Correct. Now, there's more evidence in females than there is going to be males. They might have to do more digging for the male side of things. And some of that is being pulled over from the human literature. But as far as I'm concerned, if it's questionable in mice or men, then I'm going to be, because I know that dogs are more sensitive to spermatotoxicants, I'm going to be less likely to prescribe that. And Andrea is still on here, so I'm happy if she wants to jump in on that too, because there are a lot of products out there we just don't know. Go look before you just put them on it.
Thank you.
Yeah.
The other questions were, oh, sorry, Dr. Hester, go ahead.
I was just going to say, I echo Dr. Cecere. I would definitely say it is very common for us. Like, I've got some clients that will come in and they will have, I mean, and don't worry if you're this person right now, but that will come in with 18 supplements that they are feeding their dogs. And I'm like, I don't know what 90% of these are, like, at all. I don't even know what's in them, because there's not regulation, and there's just it's so complicated. I'm not qualified to be able to balance nutrition, even with my credentials and Dr. Cecere's credentials, same thing. We have to turf to somebody who is specific to nutrition to, like, even kind of try to wrap our heads around it. So yeah, yeah, it's complicated.
Sure is. Thank you. I'm glad the puppy made an appearance. The other questions we have, Dr. Cecere, are a little more specific. So obviously, I know the recommendation is always to discuss with your general care veterinarian or reproductive veterinarian. But do you have any recommendations relating to calming an expecting or lactating bitch when they're nervous, say fireworks or thunder or whatnot?
So yeah, Adaptil is never going to hurt anything. It's not going in the body. They can even put the collar, or the plugins are going to be really, really nice. Trazodone is pretty safe for everything. And so if you actually have to reach for a pharmaceutical that you need to give them, Trazodone is usually my first go-to. And then if it's a postpartum female that is not so sure that they like their puppies or not, sepia is a natural remedy that we know that we can get over the counter and does help with some of that mothering instinct. Oxytocin can also be used, but it's harder to find someone who can compound that for you.
Thank you. Then last, just a couple questions. I know you had the parasite chart up before. A couple people obviously asked about ticks, but we also had some questions relating to any recommendations for mites and any recommendations for coccidia that would be safe during pregnancy.
Okay, so yeah, coccidia, Albon is safe from almost anything, but make sure that with coccidia, you're only treating those that are clinically affected. Coccidia stats, which means it is going to slow the growth. It doesn't actually kill the bug. Are going to be the Albon that we use is going to be safe for them. But if they're not showing clinical signs, but you find coccidia in their feces, do not treat them. They're not causing a problem. If we're having problems in a kennel, then you certainly need to work with your veterinarian and or a parasitologist to move on to the higher class, which is actually a coccidicidal. And those have to be dosed appropriately to make sure that we're actually doing it safely. So again, if the kennel's not having an issue, even though they find coccidia on a routine fecal, I wouldn't recommend treating them unless there's a problem.
Yeah, speaking to that resistance issue, Nicole, I turn it over to you. Thanks again, Dr. Cecere. That was great.
Amazing. Thank you. Dr. Hesser, while we have you back here with the puppy, of course, we did have one question that came in for you that I was hoping you could
bet.
answer.
Sure.
This is coming from, I believe, Danny, who's wondering if there's a chance of ever spreading, I'm hoping I pronounce this correctly, Neospora to other puppies, if that's possible.
Good question. So I know the answer to that. And so until I had that negative test, I felt a little bit nervous, even though technically, no, there is so dogs are part of the parasitic process for that, but it requires livestock to or sitting in like standing water. So like if you had like a bunch of dirty water containers or something, it could potentially sporulate in that environment. It basically has to be a cow. The classic scenario is a cow that say has an abortion, loses a calf, and has placental fluid or something like that. The dog then eats that fluid, and then the parasite transfers to the dog, and then the cow has to get it from ingesting the dog's feces as part of the soil when he's grazing or when she's grazing. So technically it has to go through those things, but there is mention in literature of what's called sporulation in dirty water. I've got a pretty small environment personally. So like I don't have a big sprawling acreage. The dogs don't run on property. It's a small, I live in suburbia. So it's pretty easy for me to manage my water sources. And I know that that's not possible. So for my friends' litters, that was a consideration because I still didn't know for sure what was going on. But mostly just had to talk myself down to say, no, she's not going to transfer this to those other people. It would be like if they had livestock too, and they were having issues with cleanliness. Well, yeah, it might not be the best choice because they could end up with a cycle there, but it would take that livestock species to continue the cycle.
Amazing. Thank you for answering that. And I see she's found your zipper.
She has. She's found something. This is like a very oral age right now for her.
I can watch her all day. I feel like our audience just got some great few minutes of puppy shots. So thank you.
Yeah,
I think that was all of the questions we have. Thank you so much to our audience for joining us. Thank you, Dr. Hesser and Dr. Cecere, for being with us for another amazing presentation. For everyone who has joined, please make sure that you're following us here on Facebook and that you've applied to join at gooddog.com/join so you can stay up to date on all of our future events because we have lots of them. So just to give everyone a sneak peek of 2 webinars we have coming up. Our next webinar with Purina is going to be optimizing canine health through proper life stage nutrition with Dr. Ruth Ann Lobos, which is very exciting. And that's going to be on Wednesday, May 7th at 1 p.m. Eastern. That's also where Dr. Hesser is going to be joining us again for the final session of our breeding masterclass series. It's crazy that it's already come to a close, but we're excited to have her back for that. And then before that webinar even happens, we have something new that we're trying. We're going to be showing everyone inside Good Dog's puppy training program. So that's going to be on Wednesday, April 30th, next week at 1 p.m. Eastern with Good Dog's puppy coach, Abby Johnson. We're really excited to show everyone what the puppy training program is all about, how it can help set your buyers up for success, and your puppies, of course, in their new home. So please make sure to RSVP for that. We have that up on our Facebook page already. And until then, thank you all again for being here, and we will see you at our next webinar. Bye, everyone. Thank
Thanks,
you.
guys. See ya.